Welcome back. New research from the Montefiore Einstein Cancer Center highlights a condition known as acute radiation dermatitis. The condition is found commonly in patients who undergo radiation cancer treatment. Researchers at MECC have found that many cases of ARD actually involve a common skin bacterium. The Director of Supportive Oncology Dermatology at MECC, Dr. Beth McLellan, joins me to tell us more about it. Doctor, thank you so much for joining me.
Thanks for having me. Happy to be here.
Now, can you just talk a little bit more about what acute radiation dermatitis is?
Sure. So radiation dermatitis happens when people with cancer are receiving radiation to treat that cancer. And although the radiation is really targeting the tumor or the cancer in their body, the skin is in the way. And so a lot of times the skin that's right over that area that's being treated is also affected by the radiation. It can lead to redness, skin peeling, discoloration, itching and pain, and sometimes in the more severe cases can actually break down the skin and cause sores and ulcers.
Now, can you talk about what type of cancer the radiation treatment is for?
So many different cancer types are treated with radiation. A lot of times radiation is included as part of the cancer treatment that might also include chemotherapy and surgery and other treatment modalities. Some of the most common cancers that we see affected by radiation dermatitis include breast cancer, people with cancers of the head and neck, and also cancers that involve the anogenital areas.
Now, can you talk a little bit more? I know I mentioned it's on code dermatology. Can you just talk a little bit more about, just your experience working in that field and like all the stuff that goes into, I guess, dealing with issues that come with the skin?
Sure. So oncodermatology is still a relatively new subset of dermatology. It's a group of dermatologists who focus really on treating not the cancer, but all of the side effects that can be part of cancer treatment. So we see a lot of people with rashes due to their treatment, hair loss, skin infections, and even in cancer survivors, when they're done, we see things like scars and secondary cancers that may happen in the skin down the road. Some recent research from another institution actually showed that patients who have a dermatologist included as part of their care actually live longer because we help people to remain on their treatment even when they're developing some of these really uncomfortable and sometimes dangerous side effects.
Now, is this a common occurrence for people undergoing cancer treatment? Can you just talk a little bit more about like, who's most vulnerable and, who does this actually affect?
Are you referencing radiation dermatitis
Yes.
specifically? Yeah, sure. So definitely breast cancer, head and neck cancer, and anogenital cancers are the most common. Among the women with breast cancer that we see, definitely more common in those who are receiving radiation after a mastectomy, after breast reconstruction, and also in women with larger breasts and darker skin types.
Now, I'm so glad that you mentioned darker skin. I think it's just so important. I know that like a few months ago or maybe a year ago, there was a student who talked about like the importance of recognizing darker skin in the health system. Can you first just talk about, why that's so important?
That's a really great point. There's definitely been an increase in recognition of this issue and some strategies to help solve the problem of recognizing and diagnosing different skin diseases in all skin types, including darker skin types. In radiation dermatitis, the earliest form starts with some subtle redness in the skin, and that can be hard to pick up in people who have more pigment in their skin, and that's been shown in other disease states. The grading system that's most commonly used actually grades that early form just based on the redness, and so we think that it may be difficult for people who aren't used to examining that skin type to pick up on that.
Now, I also wanted to mention, I understand that it actually affects darker skin more severely. Is that possibly because, because you don't notice it automatically, it has time to actually get worse? Can you actually just explain, why we may be seeing that in people with darker skin?
I think you're exactly right. It may just be that it's not recognized as early. And we have seen in other studies that people with darker skin types, the grading or the severity is graded lower by their provider, their healthcare provider, compared to what that person actually grades it themselves. They're more likely to need more aggressive treatments later, possibly because we're waiting too long to treat it, and they can experience more pain. But we also don't know the effect that that pigment in the skin may be playing on the way the skin reacts to radiation. So there's still definitely a lot to uncover and this disparity to address.
Now, ARD involves a common skin bacterium. Can you just tell me a little bit more about this? And I was very shocked to see that it was described as harmless, but it still can, cause a lot of problems. Like, can you just talk a little bit more about that?
Yeah, this is a concept that I think many people are surprised to learn, and we call this bacterial colonization. So basically, what that means is that there are healthy people, about 30% of normal healthy people are what we call colonized by a bacteria called Staph aureus. Some people call this staph. The bacteria is living a lot of times in their nose and in other parts of their skin, and they don't know it because it's not causing any problems. That doesn't become a problem until there's a break in the skin. So if you have a cut or you have an IV placed or you have surgery, or in this case, radiation that can kind of break down your skin, the bacteria can enter the skin, and that's where it can start to cause infections and more problems.
Now, can you tell me about the study that led you to finding more a little bit about this condition?
Yeah, so in my role as an oncodermatologist, I was seeing many people come in to see me who had radiation dermatitis, which appeared to be infected to me. And as a dermatologist, I was used to diagnosing and treating skin infections. So we started to take bacterial cultures where we swab the skin and see what type of bacteria is growing there, and found a lot of people who had that type of bacteria, Staphylococcus aureus or staph. So we based our research on that observation. We checked for staph in about 80 people who were going to receive radiation both before and after the radiation. And we found that those people who had Staph aureus present in their nose before they started treatment were more likely to develop more severe dermatitis, meaning that they had more redness, pain, and breakdown in the skin.
Now, I know when people hear bacteria, like their mind is probably like, oh my gosh, can you just talk a little bit more about that? Just for those who may not understand, like what I know there's different types and stuff like that. So you could just expand on that a little bit more.
Yeah, so we're learning so much these days about what we call the microbiome, and it's all of the different bacteria and viruses and fungi that live on our skin and in our body. And some of them can be harmful, but many of them can also be helpful. So it's the interactions between all of these different bacteria. We hope that our future research will be able to look not only at Staph aureus, which can be harmful, but some of those more helpful bacteria and understand the way those change during the course of radiation.
Now, I understand researchers initially thought nothing could be done, but there are actually ways to prevent this. Can you just tell us a little bit more about what can be done to ensure patients don't have to experience these side effects?
So, radiation dermatitis has a few different trials that have happened over the years or studies to look into different strategies to prevent it. And the way these recommendations are made varies by hospital, by physician, by part of the country. And it can be different depending on where you're getting treated and what type of treatment you're receiving. Some common things that are recommended are different types of moisturizers to the skin, keeping the area clean with a gentle soap. It's okay to use moisturizers and deodorant. For example, if you're getting radiation to the underarm area. There are some studies supporting the use of topical steroids, which are anti-inflammatory medications. And then there's an ongoing study using a type of dressing that's applied to the skin. But here we're hoping to add this bacterial decolonization or antibacterial regimen as a new option for preventing radiation dermatitis.
Now, I want to talk about, I guess, cancer treatment just in general. I know that a lot of times, like, from people who are outside of the healthcare field, there have been a lot of things associated with cancer treatment that can make it kind of scary or, just like maybe folks are a little bit more apprehensive to kind of undergo this treatment. Can you just talk about your experience as a health professional, what you've seen in regard to that?
Sure, that's a great question. I think there's so much that happens when you're diagnosed with cancer, and there's so many different side effects that are discussed when you start some of these treatments, and it can be very overwhelming. And often those that affect the skin and the hair, especially, can be the most scary and also the most devastating to people who are going through cancer treatment. It not only gives an outward face of your cancer to the rest of the world, preventing some type of privacy that people may want to maintain. It also affects the way people see themselves when they look in the mirror. It's a reminder of what's going on. It changes people's perception of their self and their identity and their culture. So I think these different skin related side effects are extremely important, and it's one of the great reasons it's great to have a dermatologist as part of your care. A lot of people who come to see me, they start out by saying, I don't want to complain. And I always tell them, when you see me, it's not complaining. This is all I do. So it's okay to spend this time and focus on these things that you may think are not important, but we see the importance of it.
And I'm so glad that you mentioned that. I think it's so nice to have a healthcare professional. I think sometimes, when you're just a regular patient, you look at, your doctor as somebody who's just kind of like, okay, these are the facts and this, this is what it is. But it's so nice to hear you have like so much compassion and really understand the emotional aspect of it. So thank you so much for sharing that. Now, because you talked about the importance of just, recognizing that and understanding that, can you just talk about, what treatment is currently available for those who are dealing with ARD?
Yeah, so the regimen that we studied is widely available. It's a prescription, two prescription medications, which are pretty inexpensive and often covered by insurance. What we studied is the combination of an antibacterial body wash that's used in the shower and then an antibacterial ointment that you actually put in your nose. And you use that combination for 5 days consecutively, and you repeat it every 2 weeks. So it's pretty safe, it's cost effective, it's easy to use, it's available. I think people can talk to their radiation oncologist or dermatologist about the possibility of including that. Um, Topical steroids, like I mentioned, moisturizers are all options for people undergoing radiation. And it's great to have options because some people might prefer a cleanser, whereas others might prefer a cream. We find some people who just don't like applying creams to the area that has cancer. That can be distressing. So having these different options available is, I think, advancing the field forward.
And where can people get this, or is it something that has to be prescribed?
The medications we studied are both available by prescription.
Okay.
We're trying to disseminate our research findings as widely as possible so that radiation oncologists are familiar and comfortable prescribing these medications. They're very safe. Only one participant in our study had any problems, which was just some mild itching. So overall, a really great option, I think, for people.
Now, I think the biggest takeaway for me in this interview that I just love that you mentioned is obviously talking about darker skin as somebody who had so many questions about my skin, and you would Google something and you'd be like, oh, I don't know if that's what I'm dealing with. Can you just talk about what you hope to see for the future of healthcare in regards to skin, and how we make it a little bit more inclusive of folks who have just different things or different backgrounds?
Yeah, I mean, definitely education is very important. So all physicians need to be comfortable, healthcare providers comfortable diagnosing, treating all skin types. And for me, a lot of that is just talking to people. I mean, I think that most people know what's best for their skin. So when I'm prescribing a medication, an ointment, a cream, a lotion, a liquid, a spray, a foam, all of those are options. So it's really working with people to individualize treatment and make it work for them. And then I think the second most important piece is research. So we know that studies that are done need to be inclusive because we don't know that those findings will apply to everyone that we're treating unless they're included in the studies. And everyone needs to have access to clinical studies so that they can also have access to these early medications. It's one reason I'm really proud to be at Montefiore Einstein, where 80% of our patients in trials are underrepresented minorities compared to just 8% in the rest of the country. So we really hope that our research is kind of moving that needle forward.
Well, Dr. McLellan, thank you so much for joining me. I truly appreciate it.
Thank you so much.
To keep up with the work that the Montefiore Einstein Cancer Center does, please go to their website at www.cancer.montefioreeinstein.org or follow them on Twitter at Montefiore NYC. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recaplecast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at bronxnet.org. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.